It's a great day at Franklin Orthopaedics. I'm Dr. Greg Cook, and I'm here to talk to you today about shoulder problems. I think there's three things that patients get as they get older, and shoulder pain is one of those welcome to middle age syndromes. I've had it. I can relate to what my patients are telling me when they come in and say my shoulder is hurting. The most common reason to have shoulder pain is a thing called impingement syndrome. Impingement is actually inflammation, perhaps some degeneration of the rotator cuff. Patients will have pain when they move their shoulder around. It's almost textbook classic that patients will have pain at night. And so if you're having shoulder pain, worse when you raise your arm up, worse with sleeping at night, you very probably have impingement syndrome. Now at home, you can go ahead and start treating this with activity modification. If you have shoulder pain, it's probably not the best idea to do some overhead hobby or chore. At that time, you'll want to rest that shoulder. Over-the-counter anti-inflammatories like Aleve or Advil would be a great place to start. And we also think that patients often respond to a good exercise program. Now, many patients are already good about exercising, and they'll do bench presses and different types of shoulder activity or exercise. But a common exercise that's often overlooked is strengthening the rotator muscles of the shoulder. And so if you're one that already works out, I'd encourage you to go ahead and work on strengthening the internal rotators. So we'd use perhaps a rubber band or a bungee cord type apparatus to strengthen pulling in across your body, and then turn the other way so that you're strengthening pulling away. And by doing that, you're strengthening the external rotators and internal rotators of the shoulders, or in essence, the muscles on the front and back of the shoulder. If that doesn't solve your problem, it's time to come see us at Franklin Orthopaedics. We'll get you in. When you call our office, the good news is a real person is going to answer the phone, so that's refreshing. We're staffed to be able to work patients in pretty expediently, so you likely are not going to be waiting very long at all for an appointment. When you come in, you can expect that we'll sit down and visit and hear exactly what your problem is, do an exam, do some x-rays. Many patients with impingement syndrome will respond to a cortisone injection. Sometimes it's almost like a magic bullet, and I find that most patients benefit from that. In fact, candidly, sometimes patients benefit a little bit too well, because we'll do the cortisone shot and then they'll sort of overlook those exercise program that I recommended. And so the cortisone shot is great to help relieve the early pain. It's really important to follow that up with an exercise program. We have physical therapy available on site, and the majority of patients that we treat are able to find the solution to their problem with these conservative measures. If you were to continue with shoulder trouble, I think it's important that you be worked up further. We have MRI machines here on site at Franklin Orthopaedics. We can easily get you in for further studies. Sometimes patients require surgery to treat impingement syndrome or other maladies in the shoulder. It's been awesome to be an orthopedic surgeon doing shoulder surgery, because there's just been an explosion of new techniques and new technology and new equipment that let us do incredibly new things and advanced surgery that we used to have to do through very large incisions. And so if you continue to have shoulder trouble, come see us at Franklin Orthopaedics and let's get to your solution.